Hello and welcome. Today we're diving deep into a kidney disease known as post-infectious glomerulonephritis, or PIGN. This is a condition that impacts the tiny filtering units of your kidneys, and it usually pops up after an infection. Let's explore what causes it, how it affects the body, and what can be done about it. So what exactly causes PIGN? Well, the primary trigger is an infection, most commonly a strep throat infection, caused by group A Streptococcus bacteria. Skin infections like impetigo can also lead to it. After the infection clears, your immune system can sometimes overact. This overreaction involves the formation of immune complexes, which circulate in the bloodstream. Now, let's delve into the pathophysiology. These immune complexes, formed in response to the initial infection, end up getting trapped in the glomeruli, the tiny filters in your kidneys. Once lodged there, they trigger inflammation. This inflammation damages the glomeruli, making them leaky. This damage disrupts the kidney's ability to properly filter waste and fluids from the blood, leading to symptoms like protein in the urine and fluid retention. PIGN primarily affects children between the ages of 5 and 15, although it can occur in adults as well. While strep throat is a global infection, PIGN is more commonly seen in areas with limited access to healthcare and inadequate sanitation, where strep infections are more prevalent and often left untreated. It's also more common in low-income populations and developing countries. What are the telltale signs of PIGN? Patients often experience edema or swelling, particularly in the face, around the eyes, and in the ankles. They may notice dark or tea-colored urine, which is a sign of blood in the urine. High blood pressure is also common. In severe cases, individuals might experience fatigue, headache, and decreased urine output. Diagnosing PIG involves several steps: a thorough physical examination and a review of the patient's recent medical history, particularly any recent infections, are crucial. Urine tests are performed to detect protein and blood in the urine. Blood tests assess kidney function, looking for elevated creatinine and urea levels, as well as signs of a recent strep infection. A kidney biopsy, where a small piece of kidney tissue is examined under a microscope, may be necessary to confirm the diagnosis and assess the extent of the damage. While PIGN doesn't really have distinct types, its severity can vary greatly. Some cases are mild and resolve quickly, while others can be more severe and lead to complications like kidney failure. The severity is often linked to the promptness of diagnosis and treatment. Treatment for PIGN focuses on managing the symptoms and supporting kidney function while the kidneys heal. This often involves dietary restrictions, such as limiting salt and protein intake. Medications like diuretics help reduce fluid retention and lower blood pressure. Antibiotics are used to eradicate any remaining infection if present, even though the initial infection is often resolved by the time PIGN develops. In severe cases, dialysis may be needed to temporarily filter the blood until the kidneys recover. The best way to prevent PIGN is to promptly and effectively treat strep throat and skin infections. Ensuring access to appropriate medical care, good hygiene practices, and completing the full course of prescribed antibiotics are crucial in preventing PIGN from developing after an infection. Fortunately, the prognosis for PIGN is generally good, especially in children. Most individuals recover completely within weeks or months. However, in rare cases, PIGN can lead to chronic kidney disease. Recent research focuses on understanding the specific immune responses involved in PIGN and developing more targeted therapies to reduce kidney damage. Ongoing studies are also investigating ways to prevent the development of PIGN after strep infections. Thank you for watching.